This is Kiruddu National Referral Hospital. On arrival, we head to the emergency ward where we find Florence Ayo, the head of nurses at the hospital, doing her supervision. The 55-year-old, who hails from Lamo district, has served as a nurse for over 3 decades. But what inspired her to join this profession?
I've been in service for the last 35 years. Okay, how I started, it was during the war of Konyi. And that was a time when the war was so bad. I had a brother who was shot and the intestine was outside. And we could not take this boy to Kiruddu Hospital. The boy needed surgery to save his life. But because the war, there was no way out for us to go to Kiruddu town. So the boy died a very, very painful death. And that one gave me a mind that I have to go and serve. I have to join medical institute so that I go and help people save life.
She says nursing is more than just a job, but rather a calling to true service.
Because when you come to the hospital, people are in pain. People have lost hope. When they come, they are looking at you. You are their source of hope.
Complaints have been raised over the unprofessional conduct of some midwives, especially towards pregnant women.
Yes, they become tough because, during the time when someone is giving birth, sometimes if you don't enforce them to push that baby, the baby can die. And when the baby died, you are the one again responsible.
She thinks that inadequate numbers of staff to deal with the huge number of pregnant women could also be a contributing factor.
Yes, understaffing is cutting across everywhere. The staffs are very, very few. Population has increased. People who are sick has increased. So when they are now stressed up, of course, what do you expect? Someone who is already tired, you call the person, can just look at you. When he comes to you, he's already not happy.
I asked her to share her experiences during the COVID-19 pandemic.
You were scared, extremely scared. When you handle them, when you reach home, you don't want even your family members to come near you. Despite
all the precautions she took, she caught the virus.
When they told me that you are COVID positive, I cried so much. I said, now this sickness is going to take me also. I was scared, of course. Then they canceled me, I was admitted.
She shares some of the factors that affect their service delivery.
Low staffing level is cutting across everywhere. And that one affects our service delivery very, very badly. And then another thing also, also lack of promotion also demoralizes people. You study, you are not promoted.
Ayo is, however, glad that government moved in to address their remuneration issues.
We have to work where we have equipment are all there. The environment is okay. The payment, we are happy that the government has enhanced our payment. But you know that money is never enough.
The mother of 4, who is in charge of 136 nurses at Kiruddu Hospital, has a message for the young people who would like to join the nursing profession.
You have to be in patient's shoes. You have to be empathetic because somebody is coming with pain. You have to be able to help those patients who are coming. You have to be self-driven. You have to be motivated. You have to be loving, you have to be caring, because you are going to offer nursing care.
Ayo says, while death cannot always be completely prevented, her inspiration is to save lives and alleviate people's suffering. Benjamin Jumbe, NTV.